My name's Lauren Yon. My major is nursing, and I studied integrating mobility as a plan of care into the intensive care units. I found my mentor because I started taking an honors research nursing course and decided I had a lot of interest in the honors and the majors programs. I looked at my different options and chose the mentor that I'd had first semester as a professor, and I thought she was a great teacher. She was easy to talk to, easily approached. She had experience as an ICU nurse, and I really respected her for what she had accomplished so far.
Hi, I'm Kelly Allred. I am an assistant professor in the College of Nursing at the University of Central Florida. The research goals that I work with students on really involves acute care nursing, improving patient outcomes in any environment that is really within a hospital. It's really fascinating to watch how the students grow through the process. They typically come with a limited knowledge of research, but they come with a question, with something they want to know more about. And we can just lead them through step by step the research process, and it's just fascinating to watch them grow through the process.
I spent a lot of time in the hospitals as a transporter and as a nurse intern, and I found that oftentimes the patients weren't being turned, they weren't being mobilized as often as they should be. So I decided to do some research and see if that was just where I was working or where I'd been, or if it was kind of everywhere. I started doing a literature review, and I found that oftentimes patients weren't being mobilized, and it was across the board. And I started looking, well, if we did start mobilizing our patients, how much better would it be for them?
The benefits of working with the undergraduate students is they bring an enthusiasm about just learning research, learning the methods. They just want to do the research to learn about what they're interested in. And their enthusiasm is just infectious, and it helps the researcher in me want to do more to help them and just to continue my own research as I help them along the way.
I found that if you were just turning your patient, you often prevented skin breakdown. If you were getting them up and sitting them in a chair, you were able to open up their lungs more, so they were able to pull in more oxygen and breathe better. And then if you were able to get them up and walk them around the unit, they did so much better, and they had ultimately less time in the hospital.
Knowing how to do research makes any young nurse a better nurse, because we as nurses base our practice, what we do with our patients in the hospitals, on evidence. And for these students to be able to go to the evidence, to know how to find the evidence, to know how to evaluate the research that's out there, they then can integrate what's already been done into their practice in the hospitals, and all of that is to improve the outcomes for our patients. And I think that's what's really interesting and fascinating about our nursing researchers in our students, is that they seem to not lose sight that they're working on these projects to improve patient outcomes.
I think having a mentor is the greatest thing, because there's someone that's always there, and there's always someone there to help you and encourage you, and just encourage you to take that extra step. So when the Showcase of Undergraduate Research came around, she pushed myself as well as the other students she was mentoring to enter it, and no one in nursing had ever done this, and I actually won first place in my division. So it was something that was just overwhelmingly amazing, and made me realize that nursing research is very important and something that's often underutilized.
Lauren had such significant findings with her review of literature in mobilizing patients in the intensive care unit. We really found that we didn't have good sound evidence to base our nursing practice on. So we're planning to move forward by doing a true research study in the ICU, probably at several different hospitals in Central Florida once she graduates.
I hope that with my research I'm able to better my patients' lives and decrease the amount of time they're in the intensive care unit, and ultimately change nursing's view on mobilizing their patients.